Acupuncture and auricular therapy are more commonly being utilized for headache management. Most people are familiar with acupuncture, but auricular therapy is seen as a subset, typically a subset of acupuncture therapy, where instead of using the entire body, you incorporate very specific points in the ear, sometimes one or both sides. And that sometimes can have a very acute benefit for pain. There's some evidence specifically for headache pain where it might be significantly helpful. It is also, interestingly, a type of therapy that's not used only with acupuncture. Several traditional medical systems that don't have a history of using acupuncture do have a history of using auricular or ear therapy, European types of medicine, Middle Eastern types of medicine, where auricular therapy was used very actively for treatment of acute and chronic pain. Well, there are many different protocols that can be utilized for incorporating acupuncture. Several studies have looked at various protocols in which tend to have a higher level of benefit. And in fact, the Cochrane Review recently did a meta-analysis on the efficacy of acupuncture in migraine prevention. And what they found was that acupuncture, specifically acupuncture, had a level A evidence rating, which is the highest rating that they can give for migraine prevention. It was as strong, or in some cases stronger, than available pharmacotherapy, if, again, acupuncture is done correctly. What that involves, doing it correctly, is typically a series of treatments, typically once or twice a week for 8 or 12 weeks to give an initial trial for the acupuncture treatment. That usually involves the patient having treatment in various what are traditionally termed headache points or pain points, as well as, at least in our clinic, a lot of ear points, which may be helpful for preventing headache, in some cases treating acute headache if they happen to have that. And that's done usually once or twice a week for the trial period. There needs to be a reassessment to see if this is a long-term keeper as far as the toolbox of what might be helpful in the integrative management for headache and migraine. Well, we know that about 3/4 of the United States population is stressed out, and that's clearly pointed out in a number of surveys. What we also know that is when a person is in pain, there can be a ratcheting up of that stress response. There can be more of the neurochemicals that are part of the part of the stress response. There's also evidence that just having pain releases some of the same chemicals. So there's really this vicious cycle of more pain, more stress, stress feeding the pain, pain feeding the stress. And so in our clinic, we just like we assess pain, we try to assess stress level. And more importantly, what is that patient's coping strategy, stress management techniques. In some cases, patients are aware of these breathing techniques, yoga, cognitive behavioral therapy. But with pain, especially pain that becomes more bothersome, many of those techniques sometimes aren't incorporated as often or as actively as we know can be helpful. In other cases, patients have not made the connection that stress is a trigger for pain, can help in the progression of pain, and if they learn simple techniques, again, like breathing, deep breathing, diaphragmatic breathing, guided imagery, then they may have a very powerful tool that can be, again, part of their toolbox for dealing with chronic pain. The other key point really is that these techniques do not have to be very complex. We're talking about deep breathing being a technique that can be done a few minutes a day, sometimes twice a day, or utilized when a person is having a pain flare. And there's now good research to show that it can help decrease pain acutely, and if done chronically, can be an additional tool.